am Gwen Pang, the head of the IFRC East Asia delegation that is based in Beijing. My office covers Japan, China, Republic of Korea, and Mongolia. And thank you for having me in this very important forum and very timely. So let me give you a brief introduction about the organization that I'm representing. The International Federation of the Red Cross and Red Crescent Societies, or we can also be called as the IFRC. We have our headquarters in Geneva, and we have 5 regional offices and country and multi-country offices situated all over the world. We are a worldwide organization, humanitarian organization, that reaches 160 million people each year. And this is made possible through the humanitarian services of our National Red Cross and Red Crescent societies. IFRC is part of an international Red Cross and Red Crescent movement. So we have 3 components of the movement. We have the IFRC, we have the International Committee of the Red Cross, whose works focus on armed conflicts, and then we also have our 192 National Red Cross and Red Crescent societies. 2 of my colleagues have presented already before me, representing 2 national societies. But online, we also have invited to join us this afternoon on this forum, virtual forum, our national societies as well. So we have a very strong volunteer network globally. We have grassroots presence. We have community-based expertise. We act before, during, and after disasters and health emergencies. We work to enable health and safe communities, reduce risks and vulnerabilities, strengthen resilience of the communities, and foster a culture of peace and nonviolence across the world. Now, as we go through our as we go through this unprecedented crisis, we are learning tremendously from the work of the Red Cross and Red Crescent societies, including government authorities and other like-minded stakeholders. China, Korea, Japan did an excellent job and offering to a pandemic situation.
생각이 비슷한 그런 기관이라든지 정부들과 저희가 함께하고 있고요. 중국과 한국과 이런 여러 국가들과도 함께 해 나가고 있는데요. 네, 소리가 들리지 않습니다. 소리가 들려서 통역이 어렵습니다. 네, 다시 소리가 들립니다. 네, 소리가 들리지 않습니다.
We have escalated that to an emergency appeal of 3 million Swiss francs. However, as the response, and demands increasing in terms of the services required and support required from us globally, the IFRC has revised its appeal to 32 million. So as it went on, the WHO have declared COVID-19 as a pandemic on March 11. As a response to that, because of the increasing needs again, the IFRC appeal was revised to 550 million Swiss francs. However, it is very difficult to keep up with the demands considering the situation and future waves in line with the UN revision of their global health response plan for COVID-19. The IFRC on May 26 have revised upward, its appeal to 1.9 billion. This includes the different national societies as well, who are providing support to in their respective countries. Let me move to the next slide. So COVID-19 have impacted all of us. Sorry, I think the slide is not moving. Can the control help me move the slide? No? It's not moving. Okay, the slide is not, okay, it's moving now. So this slide shows the impact of COVID-19. Now, COVID-19 impacted all of us and everything around us. The world is not as we used to know, and probably it will never be the same. So in this presentation, it will show us the different direct health and indirect health impacts. However, COVID-19 also impacted not just health, but also social and economic. And I have highlighted here the major impacts when it comes to health and indirect health. But among direct health impacts, the impact on healthcare system is grave and long-lasting. It stretched beyond limits. It is even severe in countries with rampant poverty, poor public system, and weak governance. The health system in general not only is overwhelmed, but still until today, supplies, equipment are not enough in many countries, and the loss of doctors, nurses, and medical workers to the virus, which made it more difficult for them to meet the huge demand for health services. Mental health, is another aspect which seeks immediate attention. There are more cases of mild to moderate need of mental health psychosocial support, and we are overwhelmed with the expressed needs. But those not identified or not expressed are left behind. Indirect health impacts are such as health services have also been disrupted because of the negative impact of this pandemic, which delayed, many of the regular health services or impacted the health services. We have seen delayed in immunization. Chronic illnesses are not attended to in many hospitals and places that we have seen. Same with communicable and non-communicable diseases. So also, we are already lagging on the SDG, and this virus pushed us further behind, especially for the health and poverty alleviation indicators. Now, going to the socio-economic realm, loss of job, loss of livelihood will lead to extreme poverty and impact, and this will have grave impact to people and less, especially in less developed countries, or I should say in less resource countries. Disruption of school system. The education sector was forced to look for newer ways of introducing learning, but the infrastructure and mindset adjustment may take some time. Even today, I had difficulty in getting online. I have tried many times. So even I'm already in a major city. So we have to be a bit patient, but we have to be able to adjust. And however, the impact here on education will have more for children that are in most difficult communities, and they may fall off the cliff. The next slide, please. Okay. So the IFRC, this slide shows us the different response tools that we have in place, even that we have been using effectively in many of the responses that we had even before. But this pandemic has challenged, many of our response tools. So in this slide, you can see the different IFRS response tools mechanism to be able for us to quickly mobilize human resource. If you look at the right side, it says ERU. That is to mobilize our human resource experts, and other skills that we need to be on the ground to support our emergency response. Equipment, you can see below on the right side. So also it has logistics and other requirements. And then funding on the upper left side. So we have a funding mechanism, which I have mentioned earlier, about the release of our DREF and also activation of our emergency appeal at the very beginning and until now that we're using to support our work. Then we also use different methods to ensure continuity of our regular work. So another one also, we have very strong information management, wherein our national societies and also our partners and even the public can have access to check some real-time reporting of what's happening on the ground, and also a repository of events that has happened that can, in fact, even help us decide, all throughout our operations. We have also developed and disseminated different guidelines, key messages, and we have activated our business continuity plan to make sure that we continue our services and we continue the operation of our office, and also have from time to time review and make sure that our response are being attended to. So now let me move to the next slide. Can someone help me move to the next slide? Thank you. So this slide is actually our global emergency appeal strategy. So this strategy, if you can see, we have elaborated in this slide, as what I have mentioned earlier. We have activated our emergency appeal. You can see on the left side the 3 operational priorities. So the priority number 1 for us is to curb the pandemic by sustaining health and WASH. And then priority number 2 is to tackle poverty and exclusion to address socioeconomic impact. Operation priority number 3 is to strengthen national society's institutional readiness for future response. So on the right side, you can see these are lists of activities that we are supporting our national society to deliver in different countries. The numbers you can see there are the numbers of national societies who are delivering, the different activities in their respective countries or respective areas. So if you can see, it's a big list. We have this communication, community engagement and health and hygiene promotion, epidemic control measure, community-based surveillance, community health, infection prevention and WASH at the community level, ambulance service, clinical and paramedical, isolation and clinical case management, management of dead, infection prevention and WASH of facility level. Then that is under priority 1. Priority 2 is about providing shelter, urban resettlement. In some of our national societies, they have even set up tents in the different communities. So we also have community engagement and accountability, social care, cohesion, support to vulnerable groups, also providing livelihood and households, especially to those daily wage earners, those who lost livelihood, and those that are most vulnerable. Priority number 3 is to support our volunteers to make sure that they're physically, mentally protected, and also that they have insurance, training required, to help deliver the work. And then also we look into the national society sustainability to ensure that we are able to sustain our operations, and also the society's requirement in the coming days, months, and years as we coexist still with this with the COVID-19. And then we also support national society readiness, to ensure that, they're ready to respond all throughout this COVID-19 time. Now, in addition to that, in addition to our response strategies, we are promoting holistic approach, on multi-hazard approaches for preparing for pandemic, especially either combined or separately with large-scale disasters or crises. So we are actively disseminating COVID-19 through multiple online, offline established DRR channels, like example, the Public Awareness and Public Education platform. So also using existing tools and creating new ones for reducing impact in densely populated communities. Community-level holistic multi-hazard preparedness plan and tool are including COVID-19, especially in the urban areas. So we are also focusing on vulnerable groups and households in this sense, and also focus on extensively using government support mechanism or Red Cross, Red Crescent volunteer networks. We have also translated many of our documents in different language, so it can use to communicate, to different groups, and it can also be understood properly. Now, aside from that, our national societies are also members of the respective government response system, and many societies have also shifted some of their roles. Many of them were asked or requested to help in receiving donation and also distribution of donation, like what our colleague from Korean Red Cross has mentioned earlier. So those are the things, but what we have seen here also, as we proceed in implementing the response, we saw solid solidarity among our Red Cross, Red Crescent national societies, and also including our partners. So may we move to the next slide, please. Can someone help me move to the next slide on organizational challenges? No? Okay. So, we also face different organization challenges as we implement our activities on the ground. So, which range from not being able to deploy our global tools, but this led to new modus operandi based on our operation, like mapping and using domestic resource and actors, adaptation of global standard to local, redefining the role of IFRC globally, and not being able to also mobilize human resource internationally to be physically on the ground. But the good thing is that we have prepared also pool of experts from the different national societies, so we have to activate that. And then we also realize that we have to train and respond more team, to be ready and to be ready to respond at any given time. And for other things that we need to do, we have to respond or support remotely. So working from home and collaboration with different actors became a norm to the IFRC. We prioritize protection of volunteers, as I have mentioned earlier. And then we adopted newer ways of working or modalities, in order to address, the challenges, as I mentioned already, the remote working, getting new technology, training our staff members, and also the national society on how we digitalize the way we work. Example, one way of digitalizing that was actually the online psychosocial support. However, sometimes sustainability of action in fragile situations, especially due to access to communities, pose also a lot of challenges to us. And in terms of the accountability mechanism vis-a-vis new ways of working, it's also very challenging because we cannot be on the ground physically to check the work. So we have to rely on the goodwill of our committees, when they deliver the services. So we also face challenges in continuing a core service of the IFRC in all our member national societies as well, especially in using of the business continuity plan tool, readiness, contingency, so that we can continue to prepare, respond, and adapt to the ever-changing situation of this COVID-19. Now, let's move to the next slide on the lessons learned. So the next slide is on our on lessons learned. Can we move to the next slide, please? Can someone help me move to the next line? To the next slide, I mean, sorry. So lessons learned. Lessons learned, so these are the lessons that we have learned. So, we have learned, all of us, I'm sure by now, that the virus of COVID-19, no borders, and they will impact every part of the world, either one way or other. So, however, we also learned that the impact is not equal to all. People with stable job, people from a country with stronger economy and public health may have better support and less vulnerabilities. However, on the other hand, countries with poverty, burden of disease, malnutrition will continue to suffer more if they do not get the support that they needed. People in unorganized sector, migrants, urban poor, and so on will be more vulnerable, and the need to support is also crucial. We also anticipate that women and children and people with disability may require more protection and proactive support to not only the primary impact of virus, but also the secondary impact of the virus as well. Now, especially from China, Italy, Republic of Korea, Japan, and Britain, we learned that simple health messages at a scale can save lives. So this one was very successful. We have seen this in many countries, that they use the communication given by the National Health Commission or their Ministry of Health in disseminating information. It helped a lot in saving lives. We also learned that the absolute adherence of technical guidance and precautionary measure, even how extreme it may sound, can curb the pandemic and stop the spread of virus. We have seen that. And we realize that it is not that one big and sure-shot strategy, but a combination of innovative strategy that works, because as we go on in this pandemic, in each stage requires different strategy, different actions from us. So that's why this is very important. Okay, my time is almost up, so I will speed up a bit. So I think I want to move to my next slide. So the next slide is can someone, yeah. So, what are the possible scenarios? This I want to leave to you, no? In the coming days, months, as we coexist with this COVID-19, it can have major resurgence. It can have new normal way of working or living, disparity and convergence. So let us move to the next slide. So in terms of major convergence, so what if, the virus mutates? What if there is a deadlier second wave of COVID that will come soon? Remember, in many of the history of pandemic that happened in the past, second wave is actually the deadlier. And what if the already overwhelmed health system collapses, resulting into substantial fatalities? What if the significant there's a significant increase in poverty, food insecurity, and social unrest? What if there's escalating tension between governments and their citizens, leading to more complex geopolitical issues as well? So these things combined can deepen the mental health crisis of the people. So are we ready for this? Can we prepare for the things that we are unknown and this kind of situation? So can we move to the next slide? So yes, believe it or not, we accept it or not, there will be new normal. Okay, we are looking into potential more home-centric living, education and working. Services are becoming more vital online. Digital skills are becoming more valuable. More situations are changing rapidly. Wearing of PPE is becoming a way of life. We have not been wearing PPE for the past before 6 months ago, but now it's like part of our life. So what will be the implication of this one? How are we able to adjust to this new normal that are becoming part of our life? Next slide, please. So the next slide is about disparity and convergence. So one more thing that we will have to build is actually on disparity and ever widening gap between the rich and poor. So we are all expecting for the vaccine to come, and we're all hoping for effective treatment. So if this will be developed, most likely, maybe it will be introduced first to more affluent countries. So those that have resources to buy may have access ahead of some. So for the Red Cross, the IFRC, we are actually advocating for people's vaccine. So we have a partnership with UN in order to advocate for this people vaccine program to reduce inequality, especially in settings where health services are scarce. As I mentioned already, women can be more impacted. And also, so we have NGOs, we have charitable organizations, aid organizations in this forum. There are also trend, of shrinking charities and aid organizations or sector. So but the needs of humanitarian needs are actually increasing. So how are we going to address that? But however, there are also local actors, rise to the challenge, and we also see this as a positive, thing that can happen. And maybe, potential large-scale voluntarism can come up because, in the midst of a crisis like this, there's always the goodness of individuals are also being inspired, and people are coming out to give their best as well. So next slide, please. So this is my last slide, which is the way forward. So in the IFRC, so we seek to strengthen our status as auxiliaries to the respective government of national societies, in the respective country. So we do not only wish to scale up, but we try to scope up our mandate and result where it is needed. In China, we took up responsibility, of especially for the IFRC in sourcing, in logistics, in delivering the much needed, equipment and supplies for many of our operations globally. So comprehensive strategy and coordinated approach is very important because we cannot do this alone by ourselves, and we have to be more coordinated because of the scarcity of resources as well, and also the cohesiveness that is required for this response. Localization is very important. That should remain to be our mantra, because we have seen here, we cannot fly goods to the ground. We have to rely on the local community people to so that we can put health and safety in their hands, which is very important. And then we have to continue to strengthen solidarity and partnership at all levels, globally and locally. And leadership engagement is very important. In the Red Cross, we have now think tank on COVID-19, which is very important, that we have to get leadership commitment, engagement, and also decision that they have to make. They have to fully understand what's going on so that we can decide for now and until the future operation. Invest more in technology and digitalization. We are doing that now. Streamline diversity and logistics of supply chain. We are doing also a lot of pre-positioning at the moment in preparation for future eventualities. Of course, be prepared for multiple or overlapping health emergencies. We also want to ensure holistic and integrated approach. We would like to continue to adjust to our service continuity plans, especially the resourcing is very important. We have seen that there's a recession happening in many places, in different levels, in different scale. So we have to be assured that with the increasing need, we also have to have the resources in place to do this work, and also prepare for the rolling out of the COVID-19 vaccine in different communities. So thank you very much. Let us work together to address the immediate and long-term impact of COVID-19 now. Thank you very much for the opportunity to speak today.